So for a patient with EGFR non-small cell lung cancer, initially diagnosed at an early stage, but then unfortunately developed one oligometastatic lesion to the brain after chemotherapy, is this patient considered stage 4 and on palliative care? And also, does this mean that local treatment with brain surgery and stereotactic radiation is now considered curative intent since it's only one site?
So one thing important to mention is we're talking about oligometastatic here instead of oligoprogression, right? So oligometastatic are patients that have the disease coming back after a curative intent, in this case is surgery. So oligometastatic when they present with disease that has traveled outside of the lung to another organ, but it's only 1, 2, or 3 organs, right? So this is an oligometastatic setting. Yes, it's still stage 4 because when the cancer travels outside of the chest, outside of the chest, lungs itself, because it travels to the pleura, which what covers the lung, it's also stage 4. So if the cancer travels outside of the chest, it's a stage 4. We do treat these lesions in the brain because one of the challenges we have is a lot of the drugs have limited data or no data about getting to the brain. So this is a very complex question that, because of the different subtypes of lung cancer. So for patients with EGFR disease, if they're symptomatic, we tend to treat these lesions. But osimertinib, which is the new drug, goes to the brain better than the other drugs. So sometimes depends on the approach. But if this patient only has disease in the brain, sometimes we treat the disease in the brain and monitor the patient off therapy. We know the disease is going to come back because already traveled to the brain, but it provides sometimes patients with time off therapy. We know that targeted therapy is easier to tolerate, but it has many side effects. It's not Tylenol, right? So sometimes it provides some patients with intervals without therapy. So oligometastatic is different than oligoprogressive. It's still stage 4. We do treat a lot of these brain lesions, but it's also dependent on the drugs that are available because patients with ALK-positive lung cancer, now we're letting the drug treat the disease in the brain before going to treat the disease of the brain if the disease is if it's not widely spread in the brain. I hope that answered the question.
Yes, that was a very comprehensive answer. And I think definitely defining oligometastatic disease versus oligoprogression is extremely important because these terms are often inappropriately used interchangeably. So, clarifying that for the patient and for those that are listening is really important. So thank you for doing that also.